Hello everyone, this is David Larson. I'm the Associate Chair for Performance Improvement in the Department of Radiology at Stanford University, and this is the Radiology Improvement Team Education Program. Today we're going to be talking about education, training, and coaching. So let's start with what it takes to be great in healthcare. We've talked about this before. Healthcare is a very complex environment, and it requires a lot to make things work well in this complex environment. Quality, as we've already defined, means to consistently do something well, and in general there are three ways to accomplish this: individual skill, processes and procedures, and systems and culture. So what does it take to develop and maintain skill in a complex environment? Well, the traditional professional model is that it starts with apprenticeship, where you have an initial period of education, training, and supervised practice. And this goes on for a period of time until you are judged to be proficient in your area and you're granted a license to practice. And then from then on you practice. And the assumption is that a professional is a master of his or her trade and is able to judge his or her own skill and maintain his or her own skill in the way that they see fit. But the reality is that's not quite how it works. There's been a lot of research that has shown that trainees graduate with a lot of deficiencies, and then some skills improve over time, but actually many skills tend to atrophy over time, especially with disuse or with lack of feedback. Furthermore, it's been shown over and over that individuals tend to overestimate their performance, especially when there's a lack of feedback about their performance. People just tend to think they do better than they actually do. And then as the field advances in an area of rapidly developing technology, individuals generally aren't able to keep up, or they don't even realize that they're not keeping up, and the field advances without them. So as much as we would like to think that once we graduate from a training program, we're set for life, the reality is that's not true. There's a lot of skill maintenance and development that happens after our training period. So if individual skill development and maintenance is critical to doing things well in a complex environment like healthcare, then how do we improve and maintain skill, especially among experienced and respected professionals? Well, the answer comes down to a combination of education, training, and coaching, and we'll talk about what we mean by those specific elements in this context. So education, as defined by Webster, is the action or process of teaching someone, especially in a school, college, or university, or the knowledge, skill, and understanding that you get from attending a school, college, or university. And so in the context that we're describing it here, it implies that we're learning about a subject, often from a basic level. So it's subject focus, and usually starting from theory, really from scratch and building from the very basics. And it's generally removed from the practical environment. So it happens in a lecture hall or a classroom or in a lab, or at least that's where it starts. So that's education, really starting at the basic level, building a foundation. The next step is training, and that is a process by which someone is taught the skills that are needed for an art, profession, or a job. And the focus here is on developing practical skills, again, often from a basic level. Again, like education, training tends to be subject-focused and occurs now in the practical environment rather than in the classroom or in a simulated environment that simulates the actual job or practice environment. The trainee tends to be closely supervised, and the trainer must be proficient at the task and a reasonable teacher. The trainer doesn't need to be a master and doesn't have to be an expert teacher, but at least must be proficient and do a reasonable job of teaching. And it happens through a cycle of instruction, practice, and feedback, and then more instruction, practice, and feedback, and so forth. So supervised practice, really. And so when it's starting from a basic level, then the trainer can be just one or two steps above the trainee. They don't have to be the master. So this is really important when you're thinking about how you're going to deploy your resources. And in fact, the trainer often learns a lot from that training experience. All right, so this gets us to our third level, and that is coaching. And this is a definition that we use because we mean it in a specific way here in this environment. And by coaching, we mean a process by which someone is individually taught, trained, and directed to achieve a higher level of performance. So here the focus is on helping an individual improve his or her performance. So it's not necessarily about the subject, but more it's about the individual to help them with their specific performance. So that requires an assessment of individual strengths and weaknesses. So you have an overall performance that you're trying to achieve and a recognition of where an individual is doing well and where they need improvement, and then a way to help them do that. This occurs in the practical environment, and the coach must be skilled both in the subject matter and in coaching. So the coach must be able to recognize good work and to know how to consistently achieve it, and then must be able to help individuals improve performance in a supportive way. So a coach really must be a master at the skill that he or she is teaching and be able to put their arm around the individual, make them feel supported and encouraged to be able to improve their specific performance, recognizing their strengths but not feeling overwhelmed, strengths and weaknesses but not feeling overwhelmed by them. So there are appropriate times when to apply each of these different strategies: education, training, and coaching. Education should be applied when you have a novice or even someone who's more experienced, but this is a new subject, or perhaps someone who's or a context where a refresher is required. Training is generally called for when there's introduction of a new technique, new tools, or new technology, such as a new piece of equipment that's being installed or a new protocol or something that's generally new. Coaching is called for when there's a need for improvement in individual performance. So not so much something that's new, but generally people who have been doing this for a period of time who now need, for some reason, to improve their performance. And honestly, we all need this at least sometime in our career and often throughout our careers. So this is not something that only outliers who need to be remediated require, but really all of us require at some point and really at multiple points in our career. All right, so let's talk about a few examples and see how you would apply each of these. So first case, a student has just enrolled in a radiologic technologist training program. So the question is, which approach should be used? The answer is education. And what will happen if the wrong approach is used? Well, if you start with training, the individual won't have the fundamentals. So they could skip over, not really understand why they're doing a lot of things they're doing. And if you start with coaching, obviously if they have no exposure, then the individual will be lost, the coach will be frustrated, and really you're not utilizing the coach's time. So you need to have a basis. You have to start with education. Okay, case number 2. A student has been in a radiologic technologist training program for a period of time, has passed all exams, and is ready to start. Which approach should be used? The answer is training. So what will happen if the wrong approach is used? So now that the student has gone through a period of education, if you continue that education, the student will become bored and won't develop those needed skills. They need to start practicing their skills. But if you jump straight to coaching, then the coach will essentially serve as a trainer. And you don't need a master level coach to serve as a trainer. You could, but generally you don't have those kind of resources. The coach is busy deployed in other ways. So you can have someone with a lower, kind of a more junior person who can serve as a trainer. Case number 3. A recently graduated technologist has just started a new job at your hospital. Which approach should be used? The answer is starting with training, but then moving at some point more towards coaching. So what will happen if the wrong approach is used? Well, if you start with education, then it's going to be a waste of your time and theirs. The technologist has already been educated and really needs to get down to using their skills they've developed. But if you start with coaching, then again, your coach is going to serve as a trainer, which is not the end of the world, but you don't really need that, especially when a lot of the new skills that are being acquired for someone who's just starting a new job is just about the idiosyncrasies of the new facility, their new environment. So that, for the first several weeks at least, they really need someone who kind of knows the ropes to help them learn how things are done at your institution. Case number 4. A new piece of imaging equipment is installed and the technologists need to learn to use it. Which approach should be used? The answer is some period of education, going quickly to training, and eventually at some point coaching. So what will happen if the wrong approach is used? Well, if there's no education, then again, they won't have the fundamentals. But these are experienced technologists, so there really shouldn't be a lot of time spent on education. If there's no training, then they'll be frustrated and they may not develop the needed skills. So that's really the majority of what you're doing here is training. And then moving eventually to coaching. If you just start with coaching, the program won't have the resources because not everyone can be coached, at least not the way we're defining coaching. So really the emphasis here is on training. All right, case number 5. You've been working as a technologist in an area for 20 years when one of your junior colleagues working on a QI project tells you that the group performance is lacking. Which approach should be used? And the answer here is coaching. So what will happen if the wrong approach is used? And this is really the crux of the whole session here. If you start with education in people who are somebody, if one of your colleagues, one of your very junior colleagues, starts with a PowerPoint, for example, when you've been doing this for 20 years, it's going to be insulting and it's almost entirely going to be a waste of time. This is not a setting for education. Same with training. If somebody tries to come in and train you as we define training, it'll be ineffective, it'll be insulting, and you're going to lose people's engagement, and they won't be supportive, and it won't be effective in the long run. This is really where coaching is required. So let's talk about the concept of the quality improvement campaign. So when you have a quality improvement project and you find that skill really needs to be improved in a certain area, what's the approach that you take? Well, here's the approach that I found works really well. First of all, identify the area in which the skill needs to be improved, and be very specific here. Second, get together and agree upon what good work looks like. And the way I recommend doing that is getting together, you and whoever's the quality improvement leader, the coach, and the expert, the subject matter expert, often that's the physician, get together and review 30 cases and agree on criteria for what constitutes good work and what's not good work. Then go separately and review 30 of the same cases independently, not the same ones you just reviewed, but the same ones you're reviewing together, and grade them, and then come back and see how you did, how consistent you were. And if you're perfectly consistent, then you're done. But generally, it takes one more time. So review 30 more cases independently, come back again, and see how consistent you are with each other. And keep doing that until you all have very specific criteria and you all apply them the same way. Third step is to start evaluating performance. Evaluate both individual and group performance, but really only share group performance with everyone. Keep individual performance confidential. Then prepare the campaign. So plan the education, training, and coaching approach, and ensure that the coach has dedicated time to both review and evaluate cases, and then to coach. Number 5, launch the campaign. So start with education, but make this brief. Just review the basics of what you're looking for and provide the basic tips and share your current level of performance. So this is what you may see. You start at a relatively low level of performance. Number 6, move into the support phase where you share a run chart showing your group level of performance and provide group feedback and share group learnings. And what you'll see is pretty quickly you'll see a bump in performance. Next, I call the transition phase, where you start providing individual feedback on performance and providing individual coaching rather than simply group feedback. And as you do that, you'll start to see another bump in performance. And finally, I call the maintenance phase, where you continue to monitor performance on an ongoing basis and often incorporate that into performance evaluations and provide feedback and coaching as needed. And this is where you start to see where you get up to the top level performance. And so it's important to recognize if you're really looking for that top level performance, you can only do that with coaching. You can't do that just with education and training. So in summary, education, training, and coaching are all important, but they're all different. So you should use education to introduce a new topic, use training to teach a new skill, and use coaching to improve performance in individuals. The coach must be a master at both the skill and also be a supportive teacher, and don't educate or train when the situation calls for coaching. Thank you for your attention. This is David Larson with the Radiology Improvement Team Education Program.